It takes just one infection from animal to human to create a pandemic. Mutations of viruses can and will infect humans. First it's one person, then it's 3, then it's 7, then it's 22. Next thing you know, the infection is across a nation, and then it spreads to the world and becomes a pandemic. How do we prevent this from going worldwide? Becoming a pandemic, it's not as easy as you think.
Hi, I'm Dr. Mark Warnick, and I have a PhD in public safety with a specialization in emergency management. I have worked in emergency management and public health emergency management, both in the field and teaching it to graduate and undergraduate classes. So the reason I'm here today is I have heard so much political baloney, and we just don't know who is telling the truth. So I did my very best to be unbiased and to review all of the records I could find on what was done for the coronavirus. And when I say that, I mean including what our government did. Now, I am considered a subject matter expert on public health emergency management and emergency management as a whole. So, I'm also a research scientist. So, I wanted to know the truth. And I've decided to share that truth with you. So, without any further ado, here we go. What I did was I took everything I could find, whether online, in the news, or whatever, and combined it all into a huge Excel list. I put these in a bunch of timelines, and this is what we got. So allow me to narrate for you. On December 31st, it became very obvious that China had an outbreak. They notified the World Health Organization, or WHO. Now, on January 3rd, China reported that they had 41 patients with a mystery illness. Also on the 3rd of January, the Center for Disease Control notifies the Health and Human Services, HHS, that there's a potential epidemic brewing. The next thing we can find is January 5th, and this is where the World Health Organization says there's no significant evidence of human-to-human transmission of COVID-19. On January 6th, the Center for Disease Control offered to China to send infectious disease researchers over to China to help them figure out what it was. And they were denied. They were told, nope, we've got it. That was the first 7 days after the initial finding. When we go to days 7 through 14, and on January 7th, China identified a new coronavirus as the cause of the outbreak. On January 8, 2020, the CDC sent out guidance to doctors nationwide and tells them to be on the lookout for this new coronavirus. On January 8th, the Center for Disease Control, CDC, releases more succinct travel alerts, something a little more focused on what to look out for and where they should travel. On January 9th of 2020, China has its first death. January 12th, China finally decides to share the genetic sequence for the COVID-19. Also on January 12th, the World Health Organization says there's no significant evidence that COVID-19 passes human to human easily. This would later be found out to be false. On January 13th of 2020, Thailand reported their first case that was imported from China. And that's the first 14 days of COVID-19. On January 14th, some HHS, or Health and Human Services employees, were ordered to make plans for the Defense Production Act. This was day 15 from the initial outbreak. Later, the Washington Post said the employees were bitterly divided and sat on the orders, slowing the response. Now, considering that there were some leftovers, it makes you wonder, or at least it makes me wonder, if these people were intentionally doing it to make the president or the Health and Human Services director look bad. On January 15th, the Trump impeachment trial began, and on that same day, China reported their second death. On January 17th, Japan reported their first imported case. On January 18th, which is still during the impeachment trial, Health and Human Services Secretary Alex Azar called President Trump at Mar-a-Lago in Florida to discuss the new virus. That same day, the World Health Organization stated that some limited human-to-human transmission was occurring between close contacts. On January 19th, China reported a huge surge in cases. In fact, those cases went up to 204 cases just over the 21 days that this virus had been active. On January 20th, the United States CDC, Center for Disease Control, began screening at the primary airports with all travel from Wuhan, China. And then on the 20th, China finally confirmed, and we don't know if they didn't know until that point or whether they were holding it back, but they confirmed that there was human-to-human transmission. And also on January 20th, South Korea reported its first case. On January 21st of 2020, the CDC, Center for Disease Control, expanded the entry health screening, adding Atlanta and Chicago to the list. Also on the 21st of January, the first confirmed case in the United States was found. And the CDC announced it had its own test for use in the United States. That same day, the World Health Organization confirmed human-to-human transmission. Additionally, the Center for Disease Control activated its Emergency Operations Center, which helps create more collaboration and assigning of duties to better organize the response. And they gave the Emergency Operations Center, or the EOC as those in Public Health Emergency Management and Public Safety call it, they gave their EOC responsibility for handling the response to the outbreak. Now, this is a common practice. What it does is it helps these different agencies work together to be more effective, more collaborative, more cooperative, and it opens lines of communication. President Trump also had a press conference that day, and according to sources, and we don't know if this is true, Trump repeated what he was told by Secretary Azar. He apparently heard that it was all under control, so President Trump stated that it was all under control. Now, we don't know from the data that I could find whether this was President Trump's doing or it was Secretary Azar's doing. And also on the 21st of January, China reported its fourth death. And all of that happened in 3 weeks. In week 4, on January 22nd, 2020, China reported they had 580 cases. The World Health Organization, after seeing 580 cases, decided to call the virus an outbreak. Now, let me explain a little bit about that. There are 3 classifications. There is an outbreak, which is local, an epidemic, which typically stays within the borders of a country, and then there's pandemic, which means it goes global. On January 23rd, the World Health Organization decided in a vote not to release a statement of international concern. So while all these leaders, world leaders, are following whose lead? The World Health Organization's lead. The World Health Organization was dragging their feet and did not call it a pandemic. Now, don't get me wrong. This is a difficult decision to make, because if you call it a pandemic or something of international concern too early, and it's not, people won't trust you. So they have to walk that fine line. Also on the 23rd, China decided to lock down and quarantine Wuhan. And that same day, Singapore reported their first imported case, and Vietnam reported 2 imported cases. So we can see from this that it's spreading very quickly. On January 24th, Japan reported its second case. The United States also confirmed a second case, and a medical journal stated concern that the new 2019 nCoV, which is what they called COVID-19, it was later changed to SARS-2, but that medical journal said that it may have acquired the ability for efficient human transmission. And the researchers warn of a threat to those with comorbidities. Airborne precautions were suggested strongly. So when we talk about comorbidities, we talk about obesity, diabetes, breathing problems, cardiac problems, things such as that. On the same day, the 24th of January 2020, the Health and Human Services opens their Emergency Operations Center to manage operations for the response. So, in effect, there's 2 EOCs, Emergency Operations Centers, working together, and they're cooperating and collaborating and communicating with each other to provide a better response. Now, something that really bothered me in all this data was the Chinese government intercepted a lab-to-lab transfer of information. So this, to a certain extent, slowed the American response. Because if we had had more information sooner, we could have done more, providing that the powers that be wanted to work on them. Also on the 24th, senators were briefed on the threat by the CDC and Health and Human Services. And that same day, China reported 830 cases and 25 deaths. This is just at the point of the middle of week 4, so approximately a month in. On January 25th, Australia reported their first case, then reported 3 more cases on the same day. Malaysia reports its first 4 cases. Canada reported their first case, and new cases were found in Japan and Thailand. China reported 1,975 cases and 56 deaths. So the death toll essentially doubled overnight, and 2.5 times more people were affected than the day before. On the 26th of January 2020, the U.S. confirmed 3 more cases, which brings the total of cases in the U.S. to 5. China reports another 900 or so cases and another 30 or so deaths from the day before. On January 27th, the FDA sent out test development proposals, and what they were doing was they were trying to ramp up so they could have more tests in a shorter amount of time. Additionally, the CDC Foundation activated their emergency response fund to support COVID-19 response. By doing this, the foundation had greater spending flexibility and can sometimes procure response supplies and services more quickly than the CDC through the federal procurement process. So they activated this fund so that they could purchase supplies without having to go through all of the red tape, or at least a large portion of the red tape. Also on the 27th of January, Cambodia, Germany, Sri Lanka all reported a case in their countries. Furthermore, Hong Kong denied travel entry from the Hubei province in China, and China reported 1,771 new cases. On January 28th, the CDC expanded the screening from 5 airports to 20. They also isolated reports that there was asymptomatic infections, meaning they were showing no symptoms but they were infected, from several countries. And when they found this out, they readily admitted that they would have to change their operations if this was true. On January 29th, President Trump created the COVID-19 task force. Now, some people that day were exacerbated because President appointed Mike Pence to oversee it. I'm going to stay neutral on this. Additionally, on the 29th of January, the United Arab Emirates reported its first 4 cases, and Finland reported their first case, and China reported that they had 7,711 people that were infected and 170 deaths. There were a little over 7,800 cases throughout the world. On January 30, the World Health Organization declared a public health emergency of international concern. This is that same thing they refused to pass a week earlier. The Philippines and India also confirmed their first cases. And on the 30th, China has 9,692 cases and 203 deaths. On January 31st, President Trump ordered travel restrictions. Now, it's important to remember that the World Health Organization just declared this an incident of international concern. And according to the timeline, this was the 30th on our date, even though it was late at night. And the next day, January 31, 45 countries shut down travel from China. Among them was the United States and President Trump travel restrictions to and from China. Now, the ironic thing here is these travel restrictions would start in 2 days. On the 31st, Alex Azar stated that a public health emergency exists and had existed since January 27th, 2020. So, according to this, The health emergency started 4 days before. However, it appears that everyone was waiting on the World Health Organization to confirm that there was international concern. Additionally, the CDC quarantined 195 passengers that traveled from China to the U.S. that day. And the CDC also said, while we still don't have the full picture and we can't predict how this situation will play out in the U.S., the current situation, the current scenario is a cause for concern. Russia, the United Kingdom, and Spain also reported their first cases on January 31, and 45 additional countries ban or restrict travel. Now, one of the things that bothered me with some of the information getting out is former Vice President Biden has been saying that 45 countries enacted restrictions before President Trump did. If you look at this, he is correct, but we're talking at a maximum of 6 hours. Now, let's look at this. Why would it be 6-7 hours difference? Because of the time zones. In the UK, they are 6 hours ahead of us. And other parts of Europe are 7 or 8 hours ahead of us. So as people were waking up that morning, they were monitoring this and they informed the president, and the president that day put restrictions into place. Now, another thing that Vice President Biden has said is that President Trump didn't take action quick enough. So this was part of the reason for doing this study, and on a whim, I decided to look at what Joe Biden had to say on January 31st, and this is what he said.
Coronavirus emanated from China. A national emergency, worldwide alerts. The American people need to have a president who they can trust what he says about it, that he is going to act rationally about it. In moments like this is where the credibility of the president is most needed, as he explains what we should and should not do. This is no time for Donald Trump's record of hysterical xenophobia, and fear-mongering.
Interesting to me. Once again, these are the reasons I did this study. On February 1st of 2020, multiple agencies began to work with the White House and the COVID task force to prepare for the coming pandemic. On February 2nd, Australia, Germany, Italy, and New Zealand also restrict global travel. On February 3rd, the United States declared a public health emergency. The Center for Disease Control released their guidance for assessing the potential risk of exposure to COVID-19 and managing those people appropriately. Additionally, Congress was notified by Health and Human Services that they had to transfer funds and additional funding would be needed. The reason they transferred funds was to stockpile what might be needed for this pandemic. On this same day, February 3rd, Michael Osterholm, director for the Center for Infectious Disease Research and Policy at the University of Minnesota, and Mark Olshacker, a documentary filmmaker, took out an op-ed where they urged stop messaging that this is a low-risk situation for the U.S. We must do the best we can with what we have, and authorities should level with the public about what we do and do not know. Now, there are different areas of knowledge that people have. And while this filmmaker and the researcher are scientists, they most likely are not trained on how to prevent mass panic. As we saw when mass panic began, that's when we started seeing an increase in suicide rates. And we also saw that toilet paper was disappearing. We saw that food was disappearing. We saw that medicines were disappearing from the store shelves. And at this point, I believe that FEMA was monitoring the message and trying to make sure that it didn't go overboard. And I also believe that they activated a joint information center, something that sends a unified message out. Now, the FDA determined that given the public health emergency declaration by Azar, there was enough justification to authorize the emergency use of the new CDC test for the coronavirus. Now, this would later come back to bite them in the butt. Additionally, Health and Human Services Biomedical Advanced Research and Development Authority announced it would leverage an existing partnership agreement with Regeneron Pharmaceuticals to develop multiple monoclonal antibodies that individually or in combination could be used to treat this emerging coronavirus, also known as 2019 nCoV. On February 4th, the Trump impeachment trial ended. So during this entire impeachment trial, he was dealing with COVID-19, almost for the entire first month of it being a potential risk for the United States. On February 4th as well, Michael Osterholm, the director of the Center for Infectious Disease Research and Policy at the University of Minnesota, releases a statement that Trump should stop downplaying the seriousness of COVID-19. This was kind of contentious. And a few months later, maybe 3-4 months later, we saw Bob Woodward come out with a recording that said President Trump was absolutely downplaying it. And in that recording, if I'm not mistaken, he was saying he was trying to prevent panic. But that panic was not prevented because of people like Osterholm and the media who really pushed the pandemic. Now, my guess is FEMA was in charge of the messaging because one of the things that emergency managers are taught is how to prevent panic so that it doesn't become a bigger disaster. If people are panicking over something that's minor risk and they do things, it can circumvent everything that's trying to be done behind the scenes. A prime example of this, they could have been trying to get the necessities out, such as toilet paper and food and water and things that might be needed during a pandemic. And instead, this rush cleaned the shelves off, and there were people that had nothing. Absolutely nothing. So while I'm not trying to make an excuse for one side or the other, that is a strategy that's used. You also sometimes want to cause panic. So as an example, in a wildfire, let's say people are kind of just sitting back, not wanting to evacuate because they don't think the fire's close enough. Well, the emergency management agency can sometimes hold a press release or create a press release or have a press briefing and tell people it's moving fast, you won't have time to get out. to create that panic. So there is a thing in emergency management where you essentially try to manage the panic in the direction that you want it to be managed. Moving on February 5th, the CDC began shipping coronavirus tests that they had made in their own lab. Also on February 5th, the Health and Human Services Secretary Alex Azar got into an argument with an Office of Management and Budget official over a request for more funding, with the official from OMB accusing Azar of improperly lobbying Congress for funding. This was over Azar going to Congress to request $2 billion for masks and other supplies, according to a Washington Post article, but Azar was rejected. On February 6th of 2020, the first United States death occurred, and the patient died at home. Additionally, the Department of Defense approved a request from Health and Human Services to provide facilities near 11 major airports to provide quarantine for up to 20 U.S. citizens per airport. On February 7th of 2020, a COVID task force press briefing, the Health and Human Services Secretary discussed travel restrictions and says the administration is taking a targeted approach aimed at slowing the virus's spread to and within the U.S., giving our government and the global community more time to take preparedness measures, understand the virus, and develop medical countermeasures. He says these policies are consistent with those of many other governments, and they are based on the current public health situation. Additionally, the State Department announces it is prepared to spend up to $100 million in existing funds to assist China and other impacted countries, both directly and through multilateral organizations, to contain and combat the coronavirus. And the State Department announced it has shipped nearly 18 tons of privately donated personal protective equipment and other supplies to China. On February 8th of 2020, New York City discovered that the tests sent by the CDC were unreliable. And on February 9th, the COVID task force met with all governors and provided a briefing to them in person. On February 10th, the government created phases of U.S. government response to the COVID-19 pandemic, which allowed them to expand and contract help and support more efficiently. And in doing that, what they did was they were using the National Response Framework to guide them on how to support the states as it was needed. What actually happens under emergency management and law is the local government is responsible for the response until they're overwhelmed, and then they request assistance from the state. And then when the state is overwhelmed, they request assistance from the federal government. And people think that the federal government can come in and ride roughshod, but this is technically against the law. What they were doing in this aspect is they were gearing up to provide the response that the states needed and declare a disaster state by state as it was needed. Also on the 10th, the Health and Human Services Administration created a deal between drug company Janssen and the Biomedical Advanced Research and Development Authority to facilitate sharing research, development costs, and expertise to help accelerate Janssen's investigational novel coronavirus vaccine into a clinical evaluation. So as early as February 10th, we know that they were working to find a vaccine. Now, this is just 10 days after travel to Wuhan was shut down, and it was 2 weeks after HHS determined that this was a threat to America. On February 11th, the Chinese President Xi refused help from the United States CDC, and they refused to share information about the virus for the third time. So not only was China responsible for it, but they refused to share information so that others could rail against it and try and overcome it. On February 12th, the CDC admitted that their tests were unreliable that they had sent out to various states. This caused a lot of problems. A whole lot of problems, and it slowed testing down. On February 13th, Secretary Azar announces CDC has begun working with 5 public health labs to test those with flu-like symptoms or potentially having the coronavirus. On February 14th of 2020, Valentine's Day, the FDA, Food and Drug Administration, announced they are proactively reaching out to manufacturers as part of their vigilant and forward-leaning approach to identifying potential disruptions or shortages. The FDA also dedicated additional resources to review and coordinate data and better identify any potential vulnerabilities to the U.S. medical product sector, specifically from this outbreak. Additionally, they said they were revamping the tests to make them more reliable. On February 14th, there was also an interagency memo that described the mitigation measures for COVID-19. And it's important to note that even at this point, they felt that the wearing of masks was not important. In fact, Dr. Fauci had said that there was no need to wear masks. And on Valentine's Day, the U.S. had 13 confirmed cases, and there were over 66,000 confirmed cases throughout the world. On February 15th, the Trump impeachment trial began. On the 16th of February 2020, 44 patients on the Diamond Princess cruise ship tested positive. The CDC suggested flying 14 infected patients home with other non-infected evacuees. The White House and the State Department weighed in with a no vote. On February 17th, American passengers were evacuated from the Diamond Princess, and it's announced that they'll be held in U.S. quarantine facilities for 14 days. Now, these quarantine facilities were on military bases. Also on the 17th of February, there's 13 confirmed cases in the United States, and there is testing of 36 people per day. The global confirmed cases are 73,258. On the 18th of February, the Health and Human Services Biomedical Advanced Research and Development Authority announced a vaccine development partnership with Sanofi, or Sanofi, however it's pronounced. On the 19th of February, the CDC warned laboratories around the U.S. against using tests without an emergency use authorization from the FDA. The CDC also posted a low-level travel notice for Hong Kong and Japan in response to the COVID-19 outbreak. And the Federal Reserve states that the threat of coronavirus, in addition to its human toll, had emerged a new risk to the global growth outlook. On the 20th of February 2020, the Association of Public Health Laboratories makes the comment that only 3 labs are capable of testing for COVID. They are in California, Nebraska, and Illinois. Additionally, after receiving a proposal from testing by email and a lower-level federal employee denying it because of how it was submitted, the FDA looks at revising the methods of submission. So, a proposal came in by email for testing, trying to get more testing going. And someone in the Food and Drug Administration said, nope, we can't do that because it wasn't submitted properly. Unbelievable. On February 21st, in South Korea, the number of confirmed cases expands from 31 to 204 in 3 days. Additionally, Italy reported its first confirmed local transmission in its Lombardy region. The UK Imperial College estimates 2/3 of the COVID-19 cases exported from China have remained undetected worldwide. This causes a panic. The South China Morning Post reports on a spike in cases in a Chinese jail. Also on the 21st, the White House COVID-19 task force considers when to move from the containment phase, trying to keep the virus from coming in or expanding in the U.S., to the mitigation phase where they try to reduce the spread of it. On that same day, the U.S. had 15 confirmed cases, up from 13 the day before, and worldwide, there's 76,809 confirmed cases. Now, I found this odd, but also on the 21st, it said that the U.S. was testing 253 people per day. I find that odd because later on, there are cases where they're claiming they're doing 50 and 75 a day. But I'm just reporting what was in there. On the 22nd of February, a New Rochelle, New York resident attended a service at his synagogue while ill. This action leads to the huge outbreak in New York City and around the city. On the 22nd, the CDC officials tell state health authorities only to send patients for testing if they have recently traveled to mainland China. And once again, they are trying to figure out what the parameters of this are. The head of the CDC tweets doctors treating patients who've recently traveled from Japan and Hong Kong, as well as other countries with coronavirus, that they should consider the possibility that the patients may have contracted the coronavirus. On the 22nd, the Trump administration requested $1 billion funding primarily for COVID-19. The CDC also issued a medium-level travel notice for South Korea and upgrades its notice for Japan to a mid-level warning. And finally, the World Health official states, it's time to prepare. It's time to do everything you would do in preparing for a pandemic. On the 23rd of February 2020, the U.S. stock market plummeted over fears of COVID-19, and it drops the worst ever in 2 years. Additionally, the CDC official flu season in the U.S. and other countries has already depleted stores of medical protective gear. The White House asked Congress to allocate $1.25 billion in new emergency funds to bolster its preparedness and repurpose another $1.25 billion in existing funds from across the government. And the Assistant Secretary for Preparedness and Response presents President Trump with a plan called 4 Steps to Mitigation. On February 23rd, the CDC also sent a letter to Congress stating the CDC's aggressive response enables us to identify potential cases early and make sure they are properly handled. On that same day, the CDC, Center for Disease Control, raised its travel notice for South Korea to its highest level and upgrades its travel notices for Italy and Iran to a medium level. On that same day, the Association of Public Health Laboratories writes to the head of the Food and Drug Administration asking to speed up the approval of tests developed by academic, private, and other labs outside the CDC. And the U.S. reported on February 23rd that the number of cases jumped from 15 to 51. And then the working group put together strategic objectives of implement broader community and health care-based mitigation measures, accelerate outreach to state and local authorities, preserve and minimize disruption to critical public and private sector services. On the 24th of February, the CDC reported that COVID-19 was heading towards pandemic status. A survey showed that 13% of nurses said that their healthcare facility had patient isolation plans in place, and 31% had personal protective equipment available. The CDC also said that disruption to everyday life might be severe, and that current global circumstances suggest it's likely this virus will cause a pandemic. The CDC also reported that they were testing as many as 400 samples a day, and they stated that there was no current backlog or delay. On the other front, the Defense Department's National Center for Medical Intelligence raised its warning levels to WatchCom 1, an imminent risk of a pandemic, and the Joint Chiefs of Staff were briefed on the risk. On the 24th of February 2020, the National Institute of Health announced that it had begun a clinical trial to test remdesivir, and the VA's liaison with CDC circulated a projection that there would be 1.7 million deaths in the U.S. without action. He also writes, referring to personal protective equipment, such as N95 masks, we should plan assuming we won't have enough PPE, or personal protective equipment. So need to change the battlefield and how we envision or define the front lines. This was a warning from the VA saying, hey, we don't have enough. Maybe we need to consider what we need to do. On February 25th of 2020, a CDC risk assessment states the potential public health threat posed by COVID-19 is high, both globally and in the United States. Additionally, President Trump states, you may ask about the coronavirus, which is very well under control in our country. We have very few people with it, and at this time, it was thought that the U.S. had relatively few. The U.S. is testing 65 people per day at this point, and there were 51 confirmed cases. Total U.S. deaths were actually 1, but that was in China. The U.S. confirmed deaths were 1, and the global confirmed cases were 80,406, with 2,708 deaths. 2 recent residents of a life care center nursing home in the suburbs of Seattle died, with the facility initially believing it was facing the flu or influenza. It would be later found out that this was COVID-19. Additionally, on the 25th of February, South Korea begins drive-through testing centers. And what they did was they set up gas station-like facilities where people can get their noses or mouths swabbed for free while sitting in their car. The results for these tests would be given out in 3 days. And President Trump appoints Vice President Pence to lead the coronavirus response effort. Now, Vice President Pence was already involved with it, but this made it official. Trump also called the Health and Human Services Secretary, Alex Azar, to express he was unhappy with the dire warnings by Nancy Messonnier. We can only assume that this was because he was trying to create calm, or possibly he wanted it his way. He wanted it released his way. On the 25th of February 2020, the CDC announced the first identified case of possible community transmission in the U.S., a case with an unknown source of exposure. And the CDC tells state and local officials through the email that its testing capacity is more than adequate to meet current testing demands. And the CDC and FDA also told state officials that the problem of flawed tests that generate inconclusive results had been resolved. Representative Nita Lowey says that despite urgent warnings from Congress in the public health community, it has taken weeks for the Trump administration to request emergency funds while tens of thousands have become ill around the world. Now, this was said, but a week before, they asked for 2.5 billion. So this really doesn't make sense to me. Additionally, on the 25th of February, an interagency phone call involving Health and Human Services and Department of Homeland Security officials, they discussed using the Defense Production Act to speed up production of N95 masks and other personal protective equipment. On January 26th of 2020, things got really crazy. Gilead Sciences initiates 2 final phase studies of its antiviral drug remdesivir as a COVID-19 treatment following the FDA's acceptance of its new drug filing. Additionally, a whistleblower filed a complaint with the Office of Special Counsel alleging that the government personnel receiving American evacuees from Wuhan were not properly trained or equipped to operate in a public health emergency situation. Also on February 26th, President Trump states, "I think every aspect of our society should be prepared. I don't think it's going to come to that, especially with the fact that we're going down, not up. We're going very substantially down and not up." He also says that he thinks schools should be preparing and get ready just in case. These words are just in case. We don't think we're going to be there. We don't think we're going to be anywhere close. Obviously, this was a misrepresentation. However, we don't know where that came from, whether it came from the CDC, Health and Human Services, or if he was speaking on his own behalf. He also, in response to a question from one of the pool reporters about boosting production of masks, he said, "In fact, we've ordered a lot of it just in case we need it. We may need it, you understand that. But in case, we're looking at worst case scenario. We're going to be set very quickly." Now, on February 26th, the U.S. was administering 111 tests per day. There were 57 confirmed cases and only one death. Globally, there were 81,388 cases and 2,770 deaths. On the 26th of February, Australia implemented its pandemic response plan in preparation for a bigger spread, and the heads of the FDA and CDC held a conference call with Health and Human Services officials. The Health and Human Services Secretary Chief of Staff began with an ultimatum. No one leaves until we resolve the lag in testing. We don't have answers and we need them. Jeffrey Shuren, the FDA's Director for Device and Radiological Health, says on that call that if the CDC was subject to the same scrutiny as privately run labs, I would shut you down. Those were his exact words. So he's coming down on the CDC. Now, this phone meeting would result in a strategy memo called A Plan to Increase COVID-19 Testing in the U.S. HHS Secretary Alex Azar stated that at least 40 public health laboratories should now be able to test using modified existing CDC kits. Additionally, on February 26, Vice President Mike Pence adds Treasury Secretary Steven Mnuchin and Larry Kudlow, a top economic advisor, to the coronavirus task force. He names Ambassador Deborah Birx, the U.S. Global AIDS Coordinator, as the White House Coronavirus Response Coordinator. Additionally, the President's Chief of Staff, Mick Mulvaney, sends a government-wide email saying all coronavirus-related communications must go through the Vice President's press secretary, Katie Miller. Now, why would they do that? Well, part of the reason they would do that is to send a unified message. When you have 6 different organizations, they release what they find, and one may release what they find, and someone else may have further knowledge of it, and they release something different, and it causes a lack of trust in officials. This is something we do in public health emergency management and emergency management. Additionally, on the 26th of February, the CDC updated its criteria to guide evaluation of persons under investigation for COVID-19. And President Trump stated, "I think it's an incredible achievement what our country's done in terms of the government's efforts to combat COVID-19. On February 27th of 2020, the U.S. was administering 204 tests per day, and the United States had 58 confirmed cases, 1 death, and the global confirmed cases was 82,746. The global deaths were at 2,814. Now, on this date, February 27th, the World Health Organization raised the coronavirus alert to the highest level. Washington State, Oregon, and California all report cases from community transmission, And a resident of a nursing home in the suburbs of Seattle tests positive for COVID-19. In Washington, Representative John Garamendi tells the press that Vice President's office directed Anthony Fauci, NIAID's director, to stand down and not appear on 5 Sunday morning talk shows to discuss coronavirus. Now, once again, this is important to send a unified message. And that unified message was going through the Vice President's press secretary. And this is standard procedure in a joint information center to have all the facts, not just the facts from one agency. Also on the 27th of February, Nancy Messonnier, the CDC's chief of respiratory diseases, said that the CDC aimed to equip every state with the ability to test for the virus by the end of next weekend. And the CDC testing criteria expanded to include travelers from China, Italy, Iran, Japan, and South Korea, and cases where respiratory illness was severe enough to require hospitalization regardless of personal or travel history. And according to the U.S. Army, problems with the CDC tests have delayed its use at civilian and Department of Defense labs. Also on February 27th, the Health and Human Services requests the activation of emergency support function for transportation, mass care, emergency assistance, temporary housing, human services, public safety and security, business and infrastructure, and external affairs. Because they put in this ESF request, emergency support function, this would bring almost everyone that is used to respond to a disaster together to spread the responsibility among these agencies in their area of expertise. This is something that is used by FEMA and emergency management at multiple levels. And it's used by local and state agencies when they need additional support from being overwhelmed. This is a standard function. Also on the 27th, a senior medical advisor at the Department of Veteran Affairs and the VA's liaison to the CDC emails that there may be a 2-week period where the outbreak can be minimized in the U.S., but the lack of testing is hampering this response. They state in that email, we have a relatively narrow window and we are flying blind. And part of the reason they felt they were flying blind, as reported in multiple news sources, was that the CDC was not capable of bringing those tests together quickly. What should have been a 1-week rollout had turned into 3 or 4 weeks by this time. On February 28th of 2020, the World Health Organization raised the alert to the highest level for coronavirus. On the 28th of February, Trump says in a press conference, we're ordering a lot of supplies, we're ordering a lot of elements that, frankly, we wouldn't be ordering unless it was something like this. But we're ordering a lot of different elements of medical. On that same day, the U.S. test administered 274 tests per day. The U.S. cases confirmed were 60 up to, and the total deaths were 1. Global confirmed cases were 84,112, and global deaths were 2,872. On February 29th, the Washington state declared a state of emergency. The White House and the CDC, along with Washington state, announced the first confirmed COVID-19 death in the United States. Now, while there was an earlier death, it was unconfirmed. Additionally, the CDC announcement notes the first confirmed healthcare worker infection in the U.S. and the first known outbreak in a United States long-term care facility. Travel warnings were raised to the highest level with regards to certain areas in Italy and South Korea, and it expanded to Iran-related travel restrictions. On the 29th of February, Vice President Mike Pence says that Health and Human Services Assistant Secretary for Preparedness and Response will be announcing courses of action to increase the availability of masks, including prioritizing availability to high-risk healthcare workers. Furthermore, the FDA announced a new policy to take advantage of tests developed by commercial, reference, and clinical laboratories nationwide to extend testing capacity. And at that point, they were testing 371 people per day. There were 68 confirmed cases, 1 verified death, and 2 total deaths. And global cases confirmed were 86,011, with global deaths at 2,941. On February 30th, researchers conclude that the virus had been spreading mostly undetected for a month and a half. This sends panic through many in the healthcare community. In Japan, the Sharp Corporation announces one of its electronic factories will turn some of its production into creating surgical masks with the aim of producing 150,000 masks a day by the end of March and eventually producing 500,000 masks a day. The U.S. test administered per day was 301. There were 74 confirmed cases in the United States, 1 verified death, 1 unverified death, and globally there were 88,369 infections and 2,996 global deaths. On March 1, a study by Cedars-Sinai states that by March 1, more than 9,000 people in the U.S. may have already been infected by COVID-19. The full report is released about a week later. On March 1, there was 301 tests per day, 74 confirmed cases in the U.S., total deaths, 1 confirmed, 1 unconfirmed, global cases, 88,369. Global deaths, 2,996. On March 2nd, it was 60 days since the first notification by China of COVID-19. Vice President Mike Pence says now we're focused on mitigation of the spread as well as the treatment of people affected. Alex Azar, the HHS secretary, said the degree of risk has the potential to change quickly. Vice President Pence participated in a video teleconference with governors and White House coronavirus task force health and science-related agencies to promote better coordination. The FDA and CDC allow for emergency use of industrial respirators in healthcare settings by healthcare personnel during the COVID-19 outbreak. The FDA and CDC allow for emergency use. The majority of respirators on the market are indicated for use in industrial settings. U.S. tests administered, 674. U.S. cases confirmed at 60 days was 98. And there is a total of 6 deaths confirmed from COVID-19 and 7, if you count unconfirmed. And the global confirmed cases were 90,306. Folks, that was the truth. I don't think that there's any mistakes. I didn't have time to go through it completely, extremely well like I would for a regular study, but I verified all the facts at least twice. This gives us a different perspective of what really happened and what was said. I hope you enjoyed this, and if you do, please make sure to like, subscribe, and comment on the Doctor of Disaster YouTube channel. Thank you, and hopefully you like and subscribe and become a member. Bye. The Doctor of Disaster is a wholly owned subsidiary of Warnick & Associates Incorporated. I'd like to remind you to like, subscribe, and comment. This helps me with the YouTube algorithm, and quite frankly, this information needs to get out.